morning and welcome to Great County Life. I hope everyone is enjoying this beautiful morning that's out there. It might be a little cool, but the sun is shining. And I have Dr. Jan Owen and Paul Van Bilsen. Did I get that right, Paul?
You got it, yeah.
Okay, here. This is Colon Cancer Awareness Month. Is that correct?
Yes, that is.
All right. So, Dr. Owen, tell me all about that. What does that mean?
Colon Cancer Awareness Month is the month that we set aside in the province to try and increase people's awareness of colon cancer and the toll it takes. In Ontario, we have 5,400 men and 4,500 women who are diagnosed with colon cancer every year. And unfortunately, we also have 3,200 people who die of colon cancer. Now, we can make a big difference there if we can convince people to get screened using a very simple little test called a fecal occult blood test kit that they can take home, do it in the comfort of their own home, and then finish it. 3 days that you do it. You test your stool and a little card, send it off in the mail, and then you'll get a result back. And if it's negative, you're good to go for another 2 years. And if it's not, then you'll be sent on for a further testing called colonoscopy.
Okay, and I'm very familiar with that because colon cancer actually runs in my family, and I can remember, and this may not be correct because this was a while ago, but I think that at that time my family doctor said you should start testing 5 years before the first diagnosed case. Is that correct? Something like that?
Well, it's changed a bit over the years, and if you have a first-degree relative, which means a brother, sister, mother, father, who had colon cancer, if they were over the age of 60, then it could be 10 years prior to that that you would start testing, doing the colonoscopy yourself. But anybody older than that, then you can do 5 years. So if you're under the age of, if your parent or your brother or sister was under the age of 60, that's the 5-year mark that we use. So 5 years, if they were 60, you'd start at age 55 getting a colonoscopy. Over 60, every 10 years colonoscopy is required. But that's just the high risk group. The majority of people are average risk, and they can get away with just doing this little kit at home.
Okay. Now, Paul, you're a survivor.
Yes, I am.
Okay,
Yep.
let's hear a little bit about your story.
Well, I was encouraged several years ago to take that test and to do it and to send it off, and it had been, like a lot of people that I've heard, is sitting in the bathroom drawer.
I
and,
know, it's not
being
something we
used.
like doing.
No, it's not. But you know what? At the end of the day, it's such an easy thing to do. So just to do it is easy.
Do you mind me asking you how old you were at that time?
At that time, I was 51.
Okay.
Well, at that time, I was the first time when they asked me to do the kit, probably was 5 or 6 years. I had that kit sitting in the drawer, not doing anything with it. So,
and a lot of people can relate to that because,
absolutely.
you know,
Yep.
you come home from the doctors, from your medical, you've got this, and then you look at it and you kind of tuck it away and you think, well, I'll do that tomorrow, and then
Yep.
tomorrow and tomorrow. And
For sure. So on the encouragement of my wife, and she said, you get another kit and get this done. And it had been sitting there again, and my doctor had given me another kit, encouraged me to make sure that I did it. And so I did the test and sent it away. And the test came back as positive. So I had to, was then scheduled to go in for a colonoscopy. And I did that last year. It was the Friday of the long weekend of August. Went in for my colonoscopy and was called into the room after and was told I had a tumor. So from there, the things happened pretty quickly. But yeah, it was a shock to find out that, you know, it's a good thing that I hadn't put it off any longer than I did.
it is.
Yeah.
Yeah. So when they find out you have a tumor, then you have the surgery.
Yep.
They remove, and you can probably tell us what happens then.
Okay, so first of all, they have a look and see what they're dealing with. And if there's a tumor there, then they will book you for surgery, but they'll also do some other investigations to see if there's any other evidence of the cancer having spread. So you'd probably have a CT scan done and some blood work. So in Paul's case in particular, he had this done, and there was nothing found. So we call that early stage, and that's exactly when we want to pick this up. But Paul didn't tell you. He didn't have any reason to do this test in his head because he wasn't having any symptoms.
Right.
He wasn't bleeding.
Right.
He was just, and so didn't have the time, busy guy.
And young.
And young, right. And in fact, we now encourage people starting at age 50 who have no family history of significance to start doing this kit and do it until age 74, so that every 2 years they do this, and if it's negative, they're good to go for another 2 years. But yes, so if Paul's had gone further than that, it would require a lot more. It probably would require chemotherapy or possibly radiation therapy. And so the earlier we catch these cancers, much quicker recovery, much better scenario. If you catch it in the first stages, and we can save 9 out of 10 people. Like, this is a
That's
good
amazing.
news story.
It is a good news story.
Yes, it is. We just have to convince people to go and talk to their doctor and figure out whether they get the kit or whether they've got a family history and have to get a colonoscopy.
Yeah, and I can, relate because my mother died, I guess you would say, of colon cancer because hers wasn't picked up soon enough. By the time they did the surgery, it had already spread to our liver and I believe her pancreas. So at that point, it's too late. It's terminal, right?
Yeah.
And that's really hard news for the family to be given. Trust me, when you think that if this had been discovered, like maybe even a year before, it would have made all the difference in the world.
Yeah. Now, I mean, if it spreads, we have a lot better treatments now. So not to just get people too scared about this, because even if it spread, we do have a lot better treatments than we would have probably at the time when your mother was diagnosed.
I think it's a good idea to scare them, especially some of those men out there.
Okay, fair enough.
Well,
Well, let me quote a number. Like right now, we have 68% 5-year survival rate, which is a term we use in the medical world to say chances are you're going to beat this. But if we picked everybody up, if everybody did this screening the way we asked them to do it, we can bump that up to 90% 5-year survival rate. So that's a huge difference. But
that's incredible.
Yeah.
That's really incredible. And I mean, easy test, not a pleasant. Well, you know what? There are worse things.
There's a lot worse things to do, and it is quite easy to do.
It is.
Yeah.
You're going to stay with me, and we're going to talk more about this. Don't go anywhere. We'll be right back on Great County Life. Welcome back. So I have Paul Van Bilsen and Dr. Jan Owen with me, and we were kind of picking on, not Paul, but the male species during our little break there, saying that, guys, you're all so macho and nothing ever happens to you. You never get sick, except when you get the dreaded man cold. But other than that, you think you're feeling great. You think you're healthy, right?
In my case, I for sure had no symptoms at all and felt fine. So it wasn't something that I felt that was an urgent priority to do, but good thing I did.
I hope you thank your wife every day for giving you that little push
Absolutely.
to get that done. And so let's talk, Dr. Owen, a little bit about the kit.
Okay, so the kit that I was talking about, it's called the FOBT, or Fecal Occult Blood Test Kit. People may have seen it. It's a little cardboard, very low-tech, green and white kit that people take home. And then prior to doing the first day, you have to do a test. You have to do this test over 3 days over the course of a week. So when you feel like you have to have a bowel movement, that's when you go and you do this, and the instructions on how to do it are pretty easy. I know everybody thinks it's icky, but it's really not that difficult to do. And there's a couple of things they have to remember before they do it, is that they can't have any citrus fruit for a couple of days or vitamin C for a couple of days before the test. That's all well spelled out in the test. And so they put a little sample of the bowel movement, or the stool, poo, on the card. And then the next day that they do it, same thing. And the third day, same thing, and then they stick it in an envelope and they mail it off, and the people at the lab will do the test, send the information to Cancer Care Ontario and the ministry, and then they in turn send you a letter back and send your doctor a letter back to tell you whether it's positive or not. If it's negative, great, that's what most of them are, and then they just have to repeat it again in 2 years. We just have to get around that ick factor about doing the test.
Yeah, but there's a lot more ickier things.
Exactly.
Yeah, that could happen. And you know, when you talk about colon cancer, we're so attuned, I think, to hearing about breast cancer and, you know, different types of cancers. You don't really think about the poor old colon.
Yeah, no, it hasn't. It's been the poor cousin, as it were, in terms of the other cancers. We hear a lot more about prostate, as you and breast cancer, as you mentioned. Women are taught from an early age that they have to get a pap test done, which is screening for cervical cancer. So we get conditioned to it as females anyway, from a very early age, about the importance of screening, which is getting a test done when you're otherwise feeling perfectly fine, so that we pick something up early and
it
treat
just
it
becomes
early.
part of your medical.
Yeah.
And exactly.
Yeah, but the colon, I think we really have shoved it off in the corner for a long time. And that's why we have this month, because we really do want to increase people's awareness that this is that silent killer over there that we can make a big difference with. Like it's we hear lots about breast cancer, and is the leading cause of death for women, followed by lung cancer, but colon cancer is right up there. And for men, it's the second leading cause of death after lung cancer. So it by far and away kills more men than prostate cancer does. But that's the one we hear a lot about, and that's good.
So, you know, you always think you're talking lung cancer, you're thinking smoking, and I know that's not the only cause of lung cancer, but are there causes out there for colon cancer?
Yeah, there are some things that put you at higher risk for sure, and it's associated with alcohol, so trying to low risk drinking. We've got some guidelines out around that. It can be associated with weight, and the certain types of food, like eating smoked meats like bacon, like that sort of thing. We try and get people to really reduce their intake of that. But you know, there's a really good program that people can do online. It's called My Cancer IQ, and just all one word, My Cancer IQ in capital letters. It'll be picked up if you Google it, and that can give you what your risk would be by plugging in a whole bunch of factors about yourself with the different prompts about whether you're average risk or high risk, and then you can go off and talk to your doctor about that. There's also 5 other types of cancers that you can find out what your risk is and what things you should be avoiding or not.
Okay, well that's really really interesting, and I'm sure there'll be a lot of our viewers out there that'll be Googling that to check it out. And you know, we were talking earlier and I said, runs in my family, so I'm high risk. Luckily, with all my colonoscopies, I have had nothing. My husband, on the other hand, who is extremely healthy, no, I don't think there's one person in anywhere in his family that have had this, and I told him he had to go. He's the one who has polyps every time. So if that hadn't been caught, then of course it would have. Do polyps automatically become cancerous?
Not always, but they really are what we're looking for in the precancerous stage. And taking those out and having a look at them under the microscope and making sure that that they're okay, that we've got it all, and then you can progress. So really, by taking those polyps out, that's a cure for cancer. That's a cure for colon cancer, by making sure that we've had a look and seen for those people who either had the higher risk from family history or the average risk who had that positive FOBT test result. If we find those polyps and take them out, and it's a specialist, it's a surgeon or a gastroenterologist, take those out, then that's a clean bill of health for a while, and they'll tell you when you have to come back.
Right. Okay. So I was quickly symptoms. And I know that, you know, you can have this, as you're an example of, Paul, without any symptoms.
That's right.
But let's talk about some symptoms
Sure.
in case there are folks
Sure.
out there that are experiencing these.
Definitely. One of the things that that is the most common is that people will notice that there is some blood in their stool or in their bowel movement mixed in with the poo or separate from it. If there's any evidence of anything that looks like blood in the toilet bowl, then they need to go and see their family doctor. They wouldn't do this kit that I was talking about. The family doctor would go ahead and do some investigations to see. There are a lot of things that can cause blood in the stool, so people shouldn't necessarily get too worried right off the bat. But that is definitely a reason for you to follow up with your family doctor and not ignore that and just think, oh, it's a hemorrhoid, for those of you who know what that is. The abdominal pain or some fullness can be a sign of colon cancer. Weight loss, a drop in your hemoglobin which is anemia.
Right.
Yeah.
Okay. So lots of things for people to look out for, and they should be contacting their doctor. Get this kit. Easy to do. Paul, we're so happy that you are a survivor, and thank you so much for both of you for coming on this morning. We'll be back with more on Grey County Life.